Okay, so the Cuyahoga County Board of Health, Z179, Micah DIXON. I'm here with is it Kevin Brennan? Brennan.
Yes.
They didn't have the N on there. I'm trying to get paper. You know what?
Yeah.
Tell me who you are from the right.
I am SUZANNE. I'm a program manager in the Food Protection Unit.
I love it. And Doctor?
GANESH, I'm medical director for Cuyahoga County.
Yeah, I am Kevin Brennan, the communications officer for the Cuyahoga County Board of Health.
Welcome to the show. I am Micah DIXON, midday host, Z179. So someone tell me, it doesn't matter who asked the question, but what does the end of public health emergency really mean?
Well, it means that the government has gotten to a point where they feel that the spread of the disease, the prevalence of illness, has gotten down to a point where we can go off of the emergency status. And for the government, what that means is a lot of things moved very quickly because of the emergency status. So things did not get bogged down in negotiations or meetings, or a lot of things moved very swiftly because of the need. So now we're going to kind of retract and go back to a more normal mode of operation.
Okay. Is it really risky for everyone, or is it only older people and those with weakened immune systems to be outside? Do we all have to still be careful since COVID has calmed down but has not really gone away just yet?
Yeah, I think we still have to be careful because we can still spread the disease to other people, including people who are immunocompromised or elderly, or the very young also. And we still have those that are very at risk. Mm-hmm. So making sure we're not spreading the disease is very important.
So would that still mean us wearing masks and gloves, or what would you...
I think that depends on the community levels. Okay. So I'm hoping not to have to say to everybody to wear masks again.
Okay.
Yeah. We want you to be aware that if you're going to be in a big, huge group of people, like you're going to a huge wedding or a huge concert, it's not a bad precaution to take. We saw a huge decline in communicable disease of different kinds, not just COVID, with the mask wearing and the good hand hygiene. We plug that hand hygiene whatever we can.
Okay.
It's not just COVID we're worried about, right? There's lots of communicable diseases. But in the case of COVID, the hand hygiene and the mask wearing really helped.
Okay. I love it. So do we still need to get vaccines?
Yeah, so good question. I am a big proponent of vaccines. As a physician, I take care of a lot of children, 2 adults, and I recommend vaccinations within my clinic. COVID vaccines have been shown to reduce the risk of severe disease. So we have recommendations and new vaccines for the new variants. So we have 6 months to over 65 that can get vaccinations now with the new bivalent vaccination.
So from 6 months and older.
Mm-hmm.
Okay.
It's different recommendations on what vaccination they get, or what the doses they get, or how frequently they get it. But yeah, we have recommendations for 6 months up.
Okay. Should young kids entering daycare, kindergarten, receive the vaccine before going to school, or before the fall, or before summer camp?
I would say so, because I think, as a Board of Health, we have a recommended slate of immunizations that we recommend to families based on the age of the child. Mm-hmm. And so COVID is definitely on our list of things that are recommended. While it's not mandated, right, we can't force anybody to do it. I think Dr. Ganesh would agree that it certainly is on the list of recommended immunizations for children especially.
And we know how sick kids get at school or camps. Those with little ones, it's like every week there's something.
Yes, a snotty nose, running, a cough.
If you can reduce the risk of one of those, it helps and goes a long way, because diseases spread rampantly within those classrooms.
And this is off the paper, but along with getting the COVID vaccine, they will also get what they should get for their age group anyway. Other vaccines, like for, what is it? Measles. Yeah, they will still get that too.
Yeah, so it's still recommended that they get all these. There's different recommendations based on age throughout, and a lot of schools require them, and it's usually state mandated. There are exemptions, but yes, those are all recommended. Measles, mumps, rubella, flu, not always flu, varicella or chickenpox, all those are often recommended.
And is chickenpox gone? Sorry, Kevin.
That's okay. I didn't step on you. It's okay.
We haven't seen it in so long, though.
We don't.
It's random.
It's definitely not gone.
It's not gone. Okay.
We don't see it as much because most people get vaccinated for it. But when I was younger, we didn't.
I got it.
I had chickenpox.
Yeah.
I just want to remind everybody too that when we talk about immunizations and vaccines, right? One thing is none of them are 100% ironclad guaranteed to protect you against what you're being immunized for. The idea is that it is the best protection that we can afford each other. And if we all get it, then we minimize the ability to spread it amongst each other. And that's why we don't see things very often like measles and polio, because there's such a density of people who've been vaccinated, right? So we pretty much nipped it, in the bud, right? But now with COVID, we want people to understand that this is not something that we feel from an emotional standpoint, or it's just because we think we want you to get it. It's based on the data, the science, the evidence, the hundreds of years of vaccine history. And so Dr. Ganesh can kind of fortify this a little bit, but it's the best method we have to protect people. So we really want people to understand that our job is not to direct you in a certain way. We just want to give you the best advice we can give you to make the best decision that you can make for yourself.
I like how you put that. It was very touching and very inviting.
Sure.
Like, I'm not going to force it, but just so you know.
It's just
That's right.
that knowledge is power.
That's what it is, right?
Okay, Dr. Ganesh, read mama.
That's it.
And with any of the vaccines, if you have questions, you can call us at the Board of Health. You can call our clinic. The idea there being, we want to be a trusted source for public health information. It's not just about what we want for you, it's what you want for you and your family. You may be traveling, you may be just having questions about summer public health. I mean, that's our job, to connect you with services.
So how does the end of COVID, the health emergency, impact our listeners when they go to the doctor?
Yeah, so a lot of the funding streams that were available, as Kevin mentioned, are gone now. But there are still supplies of vaccinations, testing, treatments that are still in stock by the federal government. So those are still free of charge for the most part, for most people. It is going to change depending on your type of insurance, Medicare, Medicaid, or any private insurance. So all those factors will probably play into effect.
So it may not be free, but it may be free.
It's going to be free for vaccinations, for treatments while supplies last.
And test kits.
The test kits are. It depends on, Medicaid should be okay till September 2024. But for Medicare, I believe it's gone, and for private insurance, it depends on the private insurance.
So a great idea there would be to flip over your insurance card and call the 1-800 number and check.
Yeah.
Sometimes scouring the website you can't find it, but there's usually Monday through Friday, usually like 8:30 to 5, something like that. There'll be someone to answer the question if they need it. And again, we can be a resource and try to connect you with services. Also 211, First Call for Help for United Way, is a great resource for connecting folks with services if they need it.
And if people can come out to our office, they can get free test kits. They just have to come. We're open Monday through Friday, 8:30 to 4:30. We're at 5550 Venture Drive in Parma. So we're near the West 130th and Snow Road area. We don't have the capacity to mail them to people, but if anybody wants to give us a call or stop by, we'd be glad to offer them test kits as well.
And I think those that are uninsured can get them from community clinics and federally qualified health centers.
I love that. So any final remarks, if there was one statement you want to leave our listeners with today, what would that be?
I think from my perspective, it would be get on it while you can, right? It's free. It's all available. You can talk to your doctor, your nurse, your pharmacist, right? Any of those people have access to your medical information, and they can, look up things for you because I think a lot of us, we don't remember where we left off. Yeah, I got a few COVID shots, but I don't remember if it was my second booster, my first one, my third one, right? So get in touch with somebody who can look at your stuff and tell you where you are and take advantage of it while you can.
I have to be one message I would have to say, hand wash, hand wash, hand wash. With all the communicable diseases, including with something like COVID, preventing contamination of hands is huge, and touching your face with your hands that are dirty is huge. So frequent, thorough hand washing, that's one of the basic principles of public health.
I would just say that my goal is to help people make the right decision for themselves, for their family, for their loved ones, and their community around them.
I love it. Thank you guys for stopping by the show.
Absolutely. Thank you for
That
having
is
us.
a wrap.
Thank
Any
you.
website you want to leave them with, though? How can they visit the websites? Phone
Sure.
numbers to call?
Our website, ccbh.net. You can also find us on Facebook, Twitter, Instagram, and if you want to call us, 216-201-2000.
Gotcha. That was easy. Okay, Kevin.
All right.
All right. Thank you, guys.
Thank you.
Okay.